Most people don't realize that what's accepted in American healthcare would feel unbelievable anywhere else. Imagine you walk into an emergency room with a sick child needing a basic blood test and some IV fluids. You expect a bill reflecting the care actually given. But then you open the envelope and see a $6,000 charge. The truth that rarely makes headlines is this: simple care can lead to overwhelming bills and financial strain, even if you're insured. Did you know that fewer than half of Americans could easily cover an unexpected $2,500 expense with cash in just 24 hours? That's the real story behind America's medical debt crisis. Picture a quiet hospital in San Diego. A parent faces a massive bill for routine treatment, while in Canada, a similar situation rarely ends in financial disaster. Scenes like this play out every day, and once you see this contrast, you can't unsee it. In this video, you'll see 9 hidden truths about how American healthcare and its costs measure up against places like Canada. Before we continue, make sure to subscribe. Number 9. The price gap, America versus Canada. Walk into a hospital in Dallas or Detroit, and you're likely paying 2.5 to 3 times more for the same procedures than in Canada. A standard blood test in the United States can be billed at hundreds or even thousands of dollars, while in Canada, the same test rarely surprises anyone with its cost. Americans are used to these inflated bills. Insurance sometimes helps, but the out-of-pocket share can still be crushing. By contrast, Canadians expect their healthcare system to cover most basic needs, leaving more money in their pockets for daily life. Number 8. Made-up numbers and shell games. The actual cost for medical services is often much lower than billed. That $12 blood test? It appears on a hospital invoice as hundreds of dollars. A bag of IV fluids priced in the supply room at $38 gets marked up to several hundred. Why? Hospitals negotiate drastically different rates with various insurers using smoke and mirrors. If you're out of network or uninsured, you pay the highest made-up prices. It's worth pausing to consider what that means for families trying to budget or retire with peace of mind. Number 7. Insurance. Help or hurdle. Insurance is supposed to shield Americans from ruinous medical bills. In reality, though, it creates a confusing marketplace. Hospital executives often agree to sky-high headline prices with insurers, then discount them behind closed doors. Preferred provider contracts favor those in the right network, but step outside that web and you're hit with inflated charges. Meanwhile, cash-paying patients without insurance at all often get stuck with the least negotiable, highest bills. Most people miss this point. The system is designed to negotiate, not to be fair. Number 6. Bankruptcy and Healthcare. An American reality. Healthcare remains the leading cause of personal bankruptcy in the United States. This isn't just another story. It confirms what some already suspected. Medical bills routinely top all other reasons for financial collapse, from mortgage troubles to credit card debt. Doctors and nurses try to offer the best care, but the structure leaves millions at risk. Many Americans must make impossible choices between treatment and savings, while in Canada, universal coverage shields most from total financial ruin. Number 5. The cost, quality, and access triangle. The entire debate often overlooks 3 interconnected levers: cost, quality, and access. Americans do receive some of the highest quality medical care in the world, especially for complex procedures like cancer surgery. It's exactly what you'd expect if you've been watching closely, or do patients elsewhere travel here for specialized treatments. Yet the United States pays much more for everything and leaves millions uninsured or underinsured, shut out from even basic services. Canada, meanwhile, covers everyone, spends far less per person, but often provides slower or less specialized care. Number 4. Trade-offs and bottlenecks. Canada's approach means everyone gets a baseline of care, but not always quickly or with full choice. Salary caps on physicians have led to shortages, with some high-earning specialists simply stopping work for the year after reaching their pay limit. In some provinces, private clinics, where you could pay out of pocket for faster service, are actually illegal. Americans used to quick turnarounds may find Canada's system restrictive, especially if looking for immediate tests like an MRI. This reveals a mindset shift. Guaranteeing universal access sometimes means rationing resources and accepting wait times. Number 3. Drug prices and global subsidies. Americans pay more for prescription drugs than anyone else. The reason traces back to policy and purchasing power. The United States subsidizes research and first access to medications by agreeing to higher prices. Governments in countries like Canada buy drugs directly and negotiate discounts, effectively letting Americans foot a larger share of the bill. While this model brings the newest treatments to American patients, it presses retirement budgets and everyday finances harder than in other developed nations. Number 2. Encouragement or avoidance. Public health priorities. The American healthcare business rarely prioritizes prevention or lifestyle changes. You're not imagining it. Discussions around healthy diet and metabolic well-being happen less often than debates over insurance coverage. There's plenty of conversation about body positivity and avoiding stigma, but encouragement to become metabolically healthier receives little support. This stands in contrast to systems that view public health as essential cost reduction, pushing preventive measures alongside treatment. It's a contradiction at the heart of the U.S. debate: extraordinary medical technology, yet little organized effort to keep people out of hospitals in the first place. Number 1. The contradiction: the best and the most broken. Here's the uncomfortable truth. America often boasts the most advanced treatments and medical minds, yet pays the highest costs, and leaves millions exposed to financial disaster. Cash rates for procedures like a colonoscopy are sometimes lower when paid directly than when run through insurance networks, yet both can result in equally confusing and outsized bills. Doctors are left unable to explain why one invoice totals $2,000 and another jumps to $6,000 for the same service. It's a reminder that what was supposed to create fairness and coverage actually multiplies confusion and risk. Americans tend to value choice and speed, but the price is a complicated web that almost no one truly understands. Drop your thoughts in the comments, and don't forget to like and subscribe for more content like this.